Hello and good evening from Rwanda's capital here in Kigali. Many thanks for joining us on this 11th day of July. Our top stories. People working in cemeteries and those living close to them are saying the fact that COVID-19 fatalities have been on the rise is clear to see because of the increasing numbers of funerals. The Ministry of Health reiterates that as COVID-19 vaccines continue to be available, plans are underway for all categories of people to be inoculated. Education officials have announced that students that contracted the COVID-19 virus will be given a chance to sit their national exams in their own special rooms because none is in critical condition. Good evening and a very warm welcome to tonight's broadcast. My name is Gloria Mutesi. Starting us off tonight, people working in cemeteries and those living close to them are saying that the fact that COVID-19 fatalities have been on the rise is clear to see because of the increasing numbers of funerals. We spoke to some of these people. Stationary with the details.
The people we spoke to assured us that they can tell when a deceased being brought for burial died of the virus or not, and that the numbers have been climbing steadily. The hearses that bring corona victims are not the same as those that bring in people who died of other causes. Before, it was difficult to see even one of those vehicles passing here. Now, it is not uncommon to see two go by. The pandemic is real, and I am saying this as a grave digger. For those who become complacent about the preventive measures, they should know that it is here and killing many people. It is obvious. The coronavirus pandemic is real, and we see it in the numbers of deceased people who are brought here after dying from it. We can tell them apart from others because the procession is escorted by doctors wearing protective clothing. And now we are receiving such processions every day because the virus is spreading rapidly. On Saturday, 17 people died of COVID-19, raising the death toll to 551 in the country since the virus was first detected in March last year. It is now commonplace to have more than 10 fatalities daily. The number of people dying from COVID-19 has been rapidly increasing. 2 months ago, it was rare to see a single fatality being brought here for burial, and now it is an average of 1 or 2 daily, which is alarming. The consequences of the pandemic are far-reaching, especially for those with loved ones it killed. Imagine your loved one dying of the virus and leaving you in these conditions, with these restrictions that limit economic activities. Maybe you too become sick in the process, and you also have to make preparations for a funeral that is never cheap. The impact on families that have lost loved ones can be devastating financially and mentally as well. What with people required to go into isolation during such circumstances. Since the start of this month of July, COVID-19 fatalities have been 10 or more a day and are now approaching 20. The infection rate is now more than 800 a day, and those in critical condition more than 60. People have been urged to protect themselves by respecting the preventive measures in place.
The Ministry of Health reiterates that as COVID-19 vaccines continue to be available, they will be distributed to people with the highest risk of being affected by COVID-19, but plans are underway for all categories of people to be inoculated as the vaccines are made available. Elderly people and essential workers are among the categories that are currently being given a COVID-19 vaccine. Kibagabaga Hospital in Kigali City is among the first places that started administering the COVID-19 vaccine, and those that have been vaccinated so far say they are grateful that they've been given a boost of protection against COVID-19 and say they will continue to adhere to the guidelines. I'm grateful. We've been fortunate to get the vaccine. I work in a bank, and so I meet so many people from all walks of life. So I'm exposed to being infected with the virus. However, this doesn't mean that I will stop wearing a mask or sanitize at all times.
babidushishikariza kwambara agapfukamunwa neza, gukaraba inshuro nyinshi.
nabyakiriye neza cyane.
I welcome the opportunity to be vaccinated because should I get the virus, I will not be very ill. Everyone is concerned because of the growing numbers of infections. Many people are dying too. It's worrying to all of us. We should all step up our efforts to prevent the spread, regardless of whether you're vaccinated or not.
Ugomba gukaza ahubwo ingamba cyane.
Niyonizeye Maurice, in charge of vaccination at Kibagabaga Hospital, says that the vaccination program is going well thanks to the awareness campaigns. Based on how things are now, we are waiting on 2,000 people. Over the last 3 days, we've vaccinated 1,000 people. People are taking this seriously as awareness and mobilization campaigns are going on. Even today, we are waiting for another possible 1,000 people for vaccination. We used to vaccinate those of 65 years and above, but now we are vaccinating even those of 55 years. But we're also looking at those that work in different companies, banks, and others in such categories. Health Minister Dr. Daniel Ngamije says that Rwanda expects to get vaccines on a weekly basis that will be distributed amongst different categories based on who needs them more. The vaccination program continues as the vaccines become available. We are inoculating elderly people and those with chronic diseases because they are most at risk of succumbing to the virus. It's important that we vaccinate across all categories. People should be patient as we do our best to get to all the people as the vaccines are made available. The Ministry of Health says that more than 392,000 people have so far received both jabs, including healthcare workers, the elderly, and other categories that are most vulnerable to the virus. Vaccination activities are expected to continue on July 12th in Rubavu district at Gisenyi Hospital and health centers across Gisenyi town. To education matters now, officials in the Ministry of Education have announced that students that contracted the COVID-19 virus will be given the chance to sit their national examinations in their own special rooms because none is in critical condition, and that all students in general have been reassured that the exams will not be any harder than they usually are. Stationary with the details.
On Sunday, students preparing to sit for their primary leaving national examinations were briefed on how they are to behave so that they can protect themselves from the virus during the period they will be sitting for the exams.
Obviously, our primary concern are the exams, but we cannot ignore the fact that there's a pandemic currently killing many people. We must respect the preventive measures in place, properly wear our masks, and practice social distancing, while avoiding lending and borrowing things from each other because that is how the virus is spread.
Teachers who have been selected to supervise the exams say they will make sure the children respect the measures, seeing that it is now a matter of life and death, far more than it has ever been before. Officials in the Ministry of Education are reassuring all students that the exams will not be any more difficult than usual considering the circumstances they studied in. I can tell you that we are confident that they are ready for these exams and also assure them that there is nothing to fear because they will be tested on what they were taught. The COVID-19 preventive measures are being enforced and their numbers will be well managed in the examination halls themselves so that social distancing is respected and the rooms themselves will be well ventilated. We are also reminding the students to respect social distancing when coming for the exams and for parents to ensure that they protect themselves while at home and remind them that all students who register to sit for the exams must come and do so. There is also the matter of students who have already been found to have contracted the virus.
None of the children who have been found to contract the virus are in critical condition, and they too will be allowed to sit for their exams tomorrow in a special room with medical personnel present. And this is so that all children get a chance to sit for their exams.
Up to 254,678 children are to sit for their primary leaving exams from Monday to Wednesday.
As the world celebrates World Population Day on July 11th, the United Nations Population Fund says that the COVID-19 pandemic has affected the health and rights of women and girls in relation to reproductive health, including the lack of access to reproductive services, as in some countries they've been stopped. Jane Mutoni now continues.
Currently, the world's population stands at 7.8 billion. As the COVID-19 pandemic is among the issues being faced by the world at large, it has also affected the provision of other health services in some countries, especially those related to reproductive health for women and girls. However, UNFPA representative in Rwanda, Mark Brian Schreiner, says it's a different story in Rwanda as nothing has changed in the provision of these services. This is also confirmed by some of the mothers who had come to a hospital in Kigali seeking reproductive services. I had come for my antenatal checkup, and the scan revealed that it's only 2 days to my due date. The service was great, and there was no problem at all. It had been a long time since I came to this hospital, and recently I was hearing rumors that they are now charging a lot, and that they are also not attending to the patients. Well, in my experience, it was nothing of such, and I was actually properly attended to by the doctor. Mark Brian Schreiner says that celebrating the World Population Day brings the issues being faced by the people at large to the fore, noting that this year's focus is on how the COVID-19 pandemic has affected the reproductive health and rights of women and girls. He also noted that the journey to eradicate factors hindering women and girls from accessing family planning services is still ongoing, as well as avoiding maternal mortality at all costs and eradicate sexual violence, along with female genital mutilation.
As the global pandemic affects countries' fertility and demography, UNFPA cautions against alarmism. What should cause alarm is when women cannot access their sexual and reproductive health and rights, whether because health services are interrupted or because gender discrimination prevents them from making decisions about their bodies. Even before the pandemic, only 55% of women in countries with data reported being able to make their own decisions about accessing health care, using contraception, and engaging in sex with their partners.
He says that in Rwanda, the demographic and health survey shows that there is a decrease in the fertility rate. He also expressed his readiness to work with Rwanda towards implementing its commitments on the rights of women and girls.
UNFPA commends the government of Rwanda for its commitment made at the historic Nairobi summit to accelerate access to sexual and reproductive health rights for all. Rwanda is making tremendous progress, and together with our valued partners, UNFPA will continue to support the realization of these commitments. Let us work together to uphold the rights to decide when and if to have a family, and let us stand up for the rights and choices of all women and girls.
UNFPA points out that due to the COVID-19 pandemic, there may be more baby boom or bust, but is pleased that Rwanda is among the countries that have done their best to ensure that family planning services continue to be delivered effectively. Jane Mutoni, RTV News.
Now on Sunday, the 11th of July, Rwandans living in Tanzania celebrated Liberation Day virtually. In a presentation made by the RPF Commissioner, Sheikh Abdul Karim Halerimana, he explained the history of the struggle to liberate the country and the fact that refugees were suffering abroad, along with injustices perpetrated against the Tutsi living in Rwanda. He stressed that the whole aim of the RPF Inkotanyi fighting to liberate the country was not to seize power, but rather to put a stop to the many problems at the time.
RPA ntabwo bari bafite umugambi wo kurwana ngo bafate.
People need to understand that the aim of the RPF fighting to liberate the country was not to seize power, but to attain a middle ground or agreement with the existing political party at the time in order for the bloodshed to stop. But the other side had other plans. When that failed, and it became clear that atrocities were being committed in Rwanda, and Habyarimana had claimed that Rwanda is like a glass full of water, on 1st October 1990, young men and girls who were residing in other countries decided to take on the responsibility to liberate the country.
The Rwandan ambassador to Tanzania, Major General Charles Karamba, commended those involved in the struggle for liberation of Rwanda, both still living today and those who passed away, for laying the foundation for the sustainable development of the country, and emphasized that it is now the responsibility of the country's youth to ensure that the development continues.
The youth are encouraged to take up the initiative on this journey of liberation to ensure that the development continues and the unity is strengthened, as well as sustainable security. Those before us laid a strong foundation, and all that is required from the youth is to speed up the process of achieving the vision as fast as possible.
We will leave it at that for today. Thank you for the privilege of your time. Enjoy the rest of the programming. Of course, not forgetting to remind you to do all that's required of you to please stop the spread of the pandemic. Otherwise, God bless you and keep you. And until next time, I'm Gloria Mutisi. Bye for now.